Good morning. Today we'll be talking about Man Up for Mental Health. Even though the men's mental health was in June, it's still very important to emphasize. Thank you, Dr. Abdulmalik, Dr. Jibril, for coming on the program. It's a pleasure to have you with us today.
Thank you for having me. Good morning, viewers and listeners.
Now we're talking about men's mental health. We know that June was a men's mental health day, and in fact, the fact that our, you know, Father's Day was also in June has given a lot of joy to a lot of men. That recognition, the fact that they're being recognized, and it's something that is very, very, it's actually very heartwarming. The fact that it's important.
Right.
People are sort of warming up their, as it were, admitting their emotional needs. And I
Right.
don't know if we can just maybe start off from that angle.
Right.
We, what is it? Why is it that men feel they must be strong, they must be aggressive? We talk about masculinity, we talk about chauvinism, we talk about our culture, and in fact, many cultures around the world. What is it that is expected of men, and when does it become toxic?
Right. Thank you very much. And I must say that this is a topic that has become very well recognized across the world and is becoming, a very common topic of discussion because previously issues around men's mental health were not recognized at all. They were not given the recognition they deserve. So increasingly, there is the recognition that this is an aspect of health that has been very neglected for a long time. And why is this so? So many reasons. You've mentioned a few of them: societal reasons, cultural reasons, upbringing, and all of that. From very early on in life, boys are allowed to play physically in an aggressive manner, play with toys, play with guns, and so on. And then when a boy cries, you tell the boy, come on, stop crying, you're not a girl. Be a man, don't cry, men don't cry. So from very early on in life, there is a sort of a lot of pressure from multiple sources: religious, societal, community, family, trying to emphasize that the male child showing emotions is vulnerability, is showing weakness, is not good enough. You should always don't show it. But from the mental health point of view, I'm a psychiatrist, and we know that every human being, right, as long as you're a human being, regardless of your biological gender, you have emotions, you have feelings. You can be hot, you can be sad, you can be unhappy, you can be proud. These are emotions that everybody experiences. So it is really against the run of nature to try and bully a particular gender to say, don't show emotions, don't cry, don't show that you are hot, don't show that you are sad, right? And unfortunately, this has been going on for eons. It didn't start yesterday. Knight in shining armor, damsel in distress, all of those stereotypes have sort of contributed to a lot of conditioning that makes men feel that they will be less of a man if they show emotions, if they show weakness or vulnerability, or admit that they need help or they are struggling. And these are the reasons that have ensured that this situation has lasted this long. And these are the things that Men's Mental Health Month and Father's Day are trying to bring to the forefront so that there is recognition and we can begin to peel the layers of this ignorance and stereotype that has been perpetuated over time. Thank you.
Yes, and in fact, indeed, some of the issues is even a lot of men are distant from their children. They don't pick up children. In the past, you'd never see a father come to parents, teachers, as day. They will
Mm.
never come to school. Then that distance, that void between the parent and the child only, grows bigger as they grow older. And then, you know, as they get older, they face their mother, they look after their mother, they neglect their father. There's so many repercussions that also come from this. It's something that it really needs to be addressed. I don't know what your thoughts are on that.
No, you're absolutely correct, Dr. Pamela. You're very correct. And, many men, therefore, let me even start from boys. Many boys from childhood to adolescence to young adulthood throughout life simply suffer in silence
Mm.
because they feel that speaking up will make them be less of a man. And so that's suffering under the table, right? The mystery, the emotional trauma and torture is a lot. For instance, globally, men are less likely to be diagnosed with a mental health problem, not because they don't have it, but because they will hide and rather suffer in silence,
Mm.
than face the shame of being identified as having, emotional weakness in quote. So these are the things that make it a problem. And even when men are diagnosed with mental health problems, they are less likely to seek for help, again, because of the stigma and not wanting to be labeled. So these are universal problems
And
globally
yet,
to
men
address.
have higher levels of suicide, don't they?
Absolutely, 5 times more. The rate of suicide among men is 5 times higher than females, completed suicide. And
Mm.
men are 3 to 5 times more likely to engage in drug abuse than females. And many
So,
times,
how is that linked?
oh, absolutely. Thank you very much for that. Many times men use drug abuse as a coping strategy, right? So they are feeling very low. They feel they're not good enough, and they want to take something that will improve their mood and give them that macho feeling, that sense of euphoria and feeling on top of the world. And so they turn to drugs. But unfortunately, that is just opening a can of worms because it then becomes an addiction. And the effect in any case is just transient. So they have to keep taking more and more, and then they end up getting addicted to the drug of abuse. And that completely opens a Pandora box of problems for them, including poor academic performance, dropping out of school, poor productivity, engaging in crime, and it totally ruins their life if they don't even die from drug overdose.
Wow. And does it actually play a part in masking mental health issues, substance abuse amongst men?
Unfortunately, it only does so initially in a very transient manner. But
Mm.
ultimately, in the long term, it deepens and worsens their mental health problems. So if you are depressed and you take something that makes you feel good for a few hours, by the time the effect of the drug wears off, your depression is still there waiting for you.
Mm.
And then you take the drug again. So you keep taking higher doses. So superimposed on the depression you have, you now have addiction to that drug again, which may also damage your liver, damage your kidneys, and cause other problems for your physical well-being, apart from also consuming your finances. So that's why I called it a Pandora box. You just open a Pandora box with multiple health problems, financial problems, social problems, when you are trying to, if you had simply identified that you had depression and was willing to get the treatment for the depression, that would have been it.
Mm. Now it's so important to talk about these things
Absolutely.
because it's important because there are people out there who are listening, people who are dealing with some of these signs. So if we can talk about it, maybe we should actually talk about some of the common mental health challenges that men face today and how do
Right.
they present? Do they present differently from women?
Mhm. Absolutely. So, I mean, we know globally that depression, for instance, is twice more common among women than men. But that doesn't mean it doesn't occur in men. In fact, it's also the commonest mental health issue among men. Depression, anxiety, substance use, bipolar disorder, and then post-traumatic stress disorder. These are the commonest, top five among men: depression, anxiety, bipolar, post-traumatic stress, substance use. Now, if you look at all of this, depression, let me just use depression as an example. When females are depressed, they are more likely to, be more weepy, withdraw and be quiet and express sadness and worthlessness and all of that, have problems with appetite and sleep, yes. But for the male gender, when they are depressed, they are more likely to be restless, hyperactive, irritable, more likely to get into quarrels, into fights, or start taking substances. So you see that the pattern of depression is a bit different in terms of how it presents with males compared with how it presents with females. The same thing with anxiety and all of the other ones.
So are there any warning signs of mental health that families or partners should be looking for in men? So that because we have people who are out there, we have a lot of women listening to this program who are very keen to find out whether in their husbands, whether in their children, how can they look out for these things in particular and make sure they catch it before it gets
Right.
complicated?
Let me start with a caveat because these are not it's not a fail proof. These are just some things to raise your index of suspicion when you see them, so that don't say, oh, Dr. Jibril said once you see this, the person has mental health problem. That's not what I'm saying. So these are potential risk factors or warning signs that we should prompt us to investigate more, right? So what you then see is that their mood may change. Either they become more withdrawn, more quiet, or they become more irritable and cranky and quarrelsome, much more than usual. So mood. The other thing is behavior. You then find that there's a lot of restlessness, hyperactivity. There's a change in behavior. Someone who was very quiet and easygoing becomes very restless, hyperactive, aggressive, right? Or the reverse. So the key thing is that you see that in their behavior, there is a change from their baseline normal pattern of behavior, either excessive or it diminishes, decreases, and they become someone who was very outgoing and jovial, now becomes very withdrawn and quiet. So behavior, then grooming, attention to detail. You then find that their eyes are bloodshot all the time. They are wearing dark shades to cover their eyes. This is very common when they start taking drugs of abuse and they want to hide, or they then start using excessive perfume to mask the odor of whatever they are smoking or whatever they are taking, so you don't catch on that something is different. So when you then notice some of these changes, or financial recklessness, you suddenly realize that they are always broke and always out of money and always looking to borrow money or to get money, or they are pawning their items like wristwatch, phone, selling property to raise money. That is also a red flag, especially for drug abuse.
Thank you so much. Thank you. Thank you, Mr. Adebowale, for coming on the program. It's a pleasure to have you with us today.
It's a
Can you
pleasure to
tell
be
us,
here.
you're a psychotherapist. Can you tell us how psychotherapists can help men with mental health issues? And also perhaps also share with us some of the emotional struggles you have, in your experience, found that men silently deal with that go off unnoticed.
All right. So for us, what we try to do is help men recover without necessarily being placed on medication. We do a lot of talk therapy and mind walks to help them realize that they have the power of their minds to heal and to build sustainable habits, change of lifestyle that would help them. So the idea behind being a psychotherapist is to help people embrace a positive change of lifestyle that is quite sustainable. Because we've had accounts of people going into rehabs, going in for treatment, at psychiatric hospitals, and then would have a relapse. So our idea is to help them heal in their natural environment, and so that that healing is sustainable for a while, and then for them to deal with past traumas and issues, because we believe that every symptom that the doctor earlier described has a root cause in their childhood formation, in their environment, in how they have been raised. So we help them trace back to the
I
cause
want to
of the events
I
and
want
they
to
heal.
challenge that, because nowadays a lot of people are saying, you know what, this blaming on childhood is it's, yes, you may have had trauma and so on in the childhood for those who had severe trauma, but now everybody is looking for blaming the fact even small traumas, they're blowing out of proportion and all that. And people are saying, is this really the way to go? Because it seems to create more traumatized adults. So I don't know what you have to say about that.
Apparently, so the idea is that we have them explore wherever the hurt, the trauma came from, and they heal from the root, not from the symptom. They heal from the root. So when they heal from the root, they begin to grow new positive symptoms in life. So the fact is, when a man comes into therapy, we're able to help them explore and really find out if there's a childhood trauma or not. Sometimes there is, sometimes there are not, but we're able to figure out what the exact problem is. I would explain. So sometimes you see a symptom of anger outburst and all the likes, and then at the root cause, they might be in grief, they might have lost something valuable, they might have lost a loved one, and then by the time we explore, we realize that that loss was the symptom for that emotional expression of anger, and then we help them grieve and heal properly, and the symptom disappears. So that's actually what happens. So because people now have thrown that word everywhere, trauma, trauma, trauma. Until people come into trauma, we do assessments to be sure that it is that there is actually trauma from childhood. Just as people throw the word depression everywhere, and they're actually not depressed. But thank God that doctor described what depression really looks like, and he gives a perfect definition.
Thank you. So anyway, we don't actually have too much time on this program, and I want to get to the how do I put it, to the root cause on this program, which is this issue of the fact that we have a culture that promotes I don't want to call it toxic masculinity, but masculinity in the form of, and that doesn't allow men seek help. What do we need to do? This is in your opinion, and of course I'd like Dr. Jibril's opinion. How can we change the culture? Is it possible? Because some of our culture is so deeply chauvinistic. Is it possible for us to change our culture and remove the stigma so that men can actually seek help?
It is very possible. And one of the things that we can do is what we're doing at the moment, creating that awareness, raising voices to speak about it. Remember that men create culture, and men can uncreate and make new cultures. So we're trying to make a lot of people realize that this is a culture we've had for a while, we can change, and this culture has become toxic and is harming our men, and there has to be a change. And thank God for the generation of men that are rising now, having this conversation, coming into therapy, and asking for help. Just yesterday, I was speaking to a bunch of, let's say about 25 men, and they really, really wanted to get help. But then we had to now make them realize that you can get help in confidentiality, where you can trust that whatever you say, is safe, and they have a safe space. So another thing again is to create a safe space for men to come in and get help, so that they can build trust that whatever they say or however they become vulnerable will not be used against them, and they can then realize the benefit of speaking up, getting help just as soon as they need them. So one major thing again that we need to create is safe spaces for men to be themselves and express how they feel.
Safe peer support groups, not just the one that tell them, oh, you have to be drinking beer and chasing women or whatever. The ones that really people can talk in. Dr. Jibril, your thoughts, please.
Yes, I think I agree that culture can be changed. Once upon a time in this country, we were killing twins as evil children. That culture has since stopped. Once upon a time in this country, we didn't understand sickle cell disease. We were calling them Obanje, Abiku, children that are spiritual and will come and torment their parents and be very sickly, then they will die, then they will reincarnate and die. But now that we understand genotype and sickle cell disease, the talk of Obanje and Abiku is gradually dying a natural death. We need to do the same for mental health, especially for mental health of men. Demystify it. Promote open conversation, which is why I'm really delighted that Dr. Pamela, you are taking this on in this program to shed light on this, educate the community. We need much more of this type of programs and education. It may be slow, but steadily and gradually, we are going to turn the tide and change will come and the stigma will reduce. And this is also the work of the Asido Foundation. promote awareness around mental health, not just for men's mental health, but for across the lifespan, children, women, adults, old age, senior citizens, across the lifespan. We need to really dispel the ignorance and the shame and the stigma around mental health generally, not just men's mental health, for people to be comfortable to discuss it and to come forward to seek help they need. And I would just like to quickly mention that there is an Asido men's locker room. It's a WhatsApp group, closed group for men. And I'm going to put the
Yes, please.
I'll
Can
read
you
it.
say the number just in case some people are out there that would like
Right.
to join?
The WhatsApp number, so you can send a message to request to join. You'll be screened, and there'll be a video screen to be sure you are male, and then you'll be added to the group. And we discuss all issues. We have
What's
psychiatrists
the
there.
number? Tell us the number quickly.
80-777-458. Again, 081-80-777-458. So send a message to that number and be added to the men's locker room.
Thank you. So how can we, well, because I know we're running out of time, but how can family and friends support a man who is struggling with his mental health? We have
So,
just a couple of minutes. If we can just have that as your, maybe I can start with Mr. Adebowale as your last words. How could they support? And then I'll come to Dr. Jibril for his last words.
the first thing is to become a voice and talk about it, and also recommend their men for help, and acceptance. They should accept the fact that men can get help and men should get help, and I think it's something that starts with the family unit. So if every family should embrace that idea, even if they don't have help, they can source for help for their men, it will go a long way.
Thank you. Dr. Jibril,
Right. So
your last words.
let's talk about it. Open conversations, no shame, no stigma. You are a human being first before you become male or female. So all human beings go through these emotions. So there is no shame or stigma. Talk about it, get the help you need. Encourage them, support them, tell them that you are proud of them to seek for help. That will encourage them to do so. Thank you.
Thank you. Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.